Ever wondered what annoys healthcare professionals the most? They navigate a unique landscape of challenges daily. And yes, there are aspects that can frustrate even the most patient among them. From misuse of medical jargon, unreasonable expectations, to the ever-looming issue of understaffing, there's a myriad of factors that can grind their gears. But don't fret, we're not here to just list the problems. We're here to shine a light on these issues and explore ways to alleviate them. Are you ready to uncover these annoyances and discover how to mitigate them? Starting our countdown at number 13, we have the misuse of medical jargon. We've all been there. The patient who thinks hypertension is a high-stress condition, or the colleague who confuses antibiotics with antibodies. This not only leads to confusion but also frustration. It's like being handed a medical dictionary in which the definitions have all been jumbled up. The bottom line? Communication is key in healthcare. Imagine trying to solve a puzzle with pieces that just don't fit. At number 12, we have the annoyance of unreasonable expectations. It's common for patients to have a Hollywood-inspired vision of healthcare. They might expect instant fixes, miracle cures, or flawless outcomes. This not only places enormous pressure on healthcare professionals, but also sets the stage for disappointment and dissatisfaction. It's crucial to remember that healthcare is complex, and outcomes can be unpredictable. A better understanding of this reality can help mitigate stress for everyone involved. Healthcare professionals are not miracle workers, although sometimes they come close. At number 11, the bane of many healthcare professionals: inefficient systems. It's a known fact that outdated systems can cause more than just minor inconveniences. They lead to delays, add to the workload, and foster frustration. Imagine trying to navigate through a labyrinth of slow, cumbersome systems when you could be attending to the needs of your patients. It's like running a marathon with a sack of bricks on your back. Time wasted on inefficient systems is time taken away from patient care. Stepping into the top 10, at number 10, we have non-compliance with instructions. It's not just frustrating for healthcare professionals when patients ignore medical advice, it's also detrimental to their health. Each time a patient doesn't follow through on a treatment plan, it often leads to repeated consultations and, unfortunately, poor health outcomes. It's a cycle that can be avoided with simple compliance. So next time your doctor gives you advice, remember to take it. Remember, healthcare professionals give advice for a reason. At number 9, we have an issue that affects many professions: lack of respect. Imagine going through years of rigorous training, only to be met with disregard or dismissiveness from the very people you're trying to help. It's not just patients. Colleagues too can contribute to a stressful work environment with their lack of respect. Remember, respect isn't about subordination, it's about acknowledging each other's roles and contributions. So let's strive for a healthier work culture, because after all, respect is a two-way street. At number 8, we find that communication breakdown causes significant annoyance. This is an all too common issue where poor communication between staff, patients, and different departments can lead to avoidable errors and shared frustration. Misunderstandings may occur, instructions may be misinterpreted, and vital patient information could get lost in the shuffle. It's a domino effect that can compromise the quality of care provided. Therefore, fostering clear, open, and consistent channels of communication is vital. Communication is key in any field, especially in healthcare. At number 7, understaffing is a major source of frustration. It's a common issue in healthcare settings that adds unnecessary stress. When there aren't enough staff members, the workload for each person increases, often becoming unmanageable. This extra load can lead to burnout, decreased job satisfaction, and, most importantly, can compromise patient care. Addressing understaffing is vital to improve the work environment and the quality of care patients receive. As the old adage goes, more hands make light work light. At number 6, we have paperwork overload. Imagine a mountain of forms, reports, and documents. It's a common sight in healthcare, isn't it? Unfortunately, this paperwork avalanche can often take away from the time and energy that should be spent on direct patient care. It's a major stressor, creating a sense of being overwhelmed, and let's face it, it's downright annoying. Yes, paperwork is a necessary part of healthcare, but it should never overshadow the importance of patient care. At number 5, we have the lack of resources. Imagine being a chef without enough ingredients or a painter without enough colors. That's how it feels for healthcare professionals when they lack the necessary resources. They're expected to deliver the best care, but how can they when the tools aren't available? It's like trying to fill a bucket with a hole in it. It's frustrating, it's demotivating. A well-resourced healthcare system can make a world of difference. Resources are the lifeblood of any healthcare system. At number 4, we have long hours and overwork. One of the biggest challenges healthcare professionals often face is the demand for their time and energy. Working long hours, night shifts, and overtime can lead to physical and emotional exhaustion, commonly referred to as burnout. This not only affects their health but also the quality of care they provide. The frustration from this overwork can be overwhelming. It's crucial to remember that even superheroes need a break. Rest is essential for optimal performance. At number 3, we have difficult patients and family members. It's no secret that healthcare professionals sometimes face challenging interactions. Patients in distress, anxious family members, they can all add to the stress of an already demanding job. This isn't about blaming anyone, it's about recognizing the emotional toll it can take. It's crucial to remember that empathy, clear communication, and a pinch of humor can go a long way in diffusing tense situations. Patience is a virtue, especially in healthcare. At number 2, we have lack of appreciation. Imagine pouring your heart and soul into a job, only to have your efforts go unnoticed. This is a reality for many healthcare professionals who work tirelessly to ensure patient health and well-being. The absence of acknowledgement and appreciation can be incredibly demoralizing, creating a sense of invisibility that can lead to burnout. It's important to remember that appreciation costs nothing, but its value is immeasurable. A simple thank you can go a long way. And the number one annoyance for healthcare professionals is inadequate compensation. Picture this: you're working long hours, facing high levels of stress, and juggling multiple tasks, all in the name of providing top-notch care. Yet, your paycheck doesn't reflect the gravity of your responsibilities. This mismatch can stir dissatisfaction and frustration, making it tough to stay motivated. It's clear then, that the compensation should not only cover the bills, but also acknowledge the immense value these professionals bring to our lives. Compensation should reflect the value of the work. So there you have it, the 13 things that totally annoy healthcare professionals. From the misuse of medical jargon to inadequate compensation, these annoyances paint a picture of the challenges our healthcare heroes face daily. Unreasonable expectations, inefficient systems, and non-compliance with instructions all contribute to the stress of their work environment. Respect, communication, and staffing are all crucial elements that need to be addressed in healthcare settings. Overload of paperwork, lack of resources, and long hours can lead to burnout and a decrease in productivity. Dealing with difficult patients and family members and a lack of appreciation can make the job all the more trying. Addressing these issues is vital. Encouraging proper use of medical language, setting realistic expectations, streamlining systems, and ensuring compliance can help. Fostering a culture of respect, improving communication, adequately staffing, reducing paperwork, and providing necessary resources are all steps in the right direction. Remember, understanding and addressing these annoyances can lead to a more productive and satisfying work environment for healthcare professionals.